Tomorrow is National Drug Take-Back Day, a day when you're encouraged to go through your cabinets and safely dispose of expired drugs or drugs you no longer take. Many police stations and health facilities will be open, willing to take those drugs off your hands, no questions asked. Right now, we're joined by Ellen Walkus, Senior Pharmacy Specialist with Priority Health. And Ellen, this is the second Drug Take-Back Day of the year. It happens twice a year. Yeah. Sounds like you guys really gathered some expired and no longer wanted drugs last time around.
Yeah, so in April, I coordinate 3 sites and we collected 584 pounds of medication. So this medication that wasn't misused and was disposed of in an environmentally safe way. So that was really good.
The proper way, yeah. So this Drug Take-Back Day tomorrow, you guys are giving something away. It's very important. Tell us about it.
Yeah, so we're giving away Narcan, and we know that Narcan saves lives. And Priority Health is committed to the health and safety of our members and also the communities that we serve. And what Narcan is it's actually the it's actually the opioid reversal agent.
Yes.
So if someone is having an opioid overdose, you can give them Narcan and they will and potentially save their lives.
Yeah, there are some myths about having Narcan and Narcan in general. Let's talk about those myths.
Right. Some people think that Narcan is not safe. That's not the case. It's actually given over the counter now. So it is a very safe medication. It's not a narcotic. And I'll show you, it actually comes as a nasal spray, right?
Okay.
So it's a very safe medication to have. Yep.
It's not even a needle or something that somebody might want to stay away from. Okay.
Yes, exactly.
A lot of people will hesitate having this in their house. Why and why should they not?
Yeah, some people think that it encourages more drug use, and that's not the case. We know that Narcan saves lives, and that's why it's not only available over the counter, but it's also available in Kent County in many of the free vending machines as well.
So it's a nasal spray. How does it work in the body? Can you briefly explain that?
Yeah. So basically, it's supposed to be easy enough for a 6-year-old to use. So it is very easy. So the box comes like this. You basically, it gives you step 1, checking for overdose signs and symptoms. You give the Narcan nasal spray right in their nostril. It should work within a couple of minutes. And number 3, it's really important that then they call 911 and they get help. There's actually 2 doses in these boxes because a lot of the narcotics that we're very worried about now is fentanyl is much stronger, and some may need 2 doses. So the boxes have 2 doses in there.
As you've said, Narcan is more and more available over the counter. You hear about vending machines in different places having them. Why is it important for Priority Health to want to do this giveaway?
Well, we know that Narcan saves lives, and what we hope is that we'll be able to reverse the opioid overdose when it's happening, and then the patients can get help. And what we recommend is if someone you love or you know has substance use disorder, start with their health insurance, because Priority Health actually has a behavioral health hotline. It's open 24 hours a day, 7 days a week, and we have specialists that deal with substance use disorder that they can talk to and get help. There's a lot of other resources as well, so we'll have those resources. We'll have Kent County Opioid Task Force as well as Pine Rest, and also Corewell Health has walk-in clinics now to help people get treatment.
So let's take a look at those locations tomorrow that will have the Narcan for free available. You see them on your screen right now. And again, a lot of places will be taking those drugs back for free, no questions asked. Pharmacies, police stations.
Yep, and also they can go to DEA Drug Take-Back Day, and there's actually a location finder. And I think you made an important point too. This is completely anonymous, so people should feel very comfortable dropping off their medication. And I have to say it because we've had so much rain. It's going to be a drive-up event, so they don't even have to get out of their car.
Perfect.
So they won't have to get wet. We might get wet, but they won't get wet.
Ellen Walkus from Priority Health, thank you so much for joining us.
Yep, thank you.